Hi everyone, welcome back. I'm Gillian McCabe and I'm specialist physiotherapist in pelvic health, and I'm here again with Gilly Bond in a slightly different and lighter room today. So we're here to talk about pelvic girdle pain related to pregnancy and try and give you some information and some tips on how to deal with the symptoms that you might be experiencing at the moment.
Grand. So Jill, what is pelvic girdle pain?
Well, if you want to know more about pelvic girdle pain, the best place to go is to download one of the best booklets from the Pelvic Obstetric and Gynecological Physiotherapy group. So we're going to put the link down below. I'm guessing it's down below, somewhere along there. So click on that link and you can download that booklet. It comes up as a PDF and I think you can print that one off. The other ones you can't print off, but that one you can print off, or you can keep it on your phone or your tablet, wherever. But it goes through exactly what pelvic girdle pain is and what you can and can't do. But basically, pelvic girdle pain is pain at the front of your pelvis, around the symphysis pubis, or pain around the back of your pelvis, around the sacroiliac joints, which are basically the top of your buttocks, and you've got two joints there that can become painful. And it can be one-sided or it can be both sides. You can find that you have hip pain, limited range of movement in your hips, difficulty standing on one leg. So for instance, putting your trousers on in the morning, you might find that you have to sit down to do that. You can get other symptoms like sciatica, radiating pain down the back of your legs, or pain coming down your inner thighs.
Or pain up as
or
well.
Pain up into the vaginal walls, or pain up into your back, pain into your abdominals. It can be quite wide-ranging, but generally it stems from too much movement or asymmetrical movement between those joints, which we'll talk a bit more about later.
Yeah, one thing that we really wanted to stress is that it's not normal to have pain with pregnancy, and a lot of our ladies that come and see us have struggled on far too long with pelvic girdle pain, thinking that it's normal that their back hurts, their hip hurts, their vagina hurts when they're pregnant, but it's not. It's something that can be really, really effectively treated with physio. And so you shouldn't be listening to those people saying, oh, it's all right, it'll be fine when you deliver, just carry on.
It's just part of normal pregnancy.
It's not.
And you know yourself, especially if you've had a previous pregnancy, that it's very different from maybe what you experienced during that pregnancy. But if it's your first pregnancy, it's really difficult. So other healthcare professionals or friends or family members might be saying it's normal, but really if you're struggling to walk or you need help to put your socks on in the morning, that's not normal.
No. Okay. So, what would we say is the first thing that we tell everyone who's got pelvic girdle pain?
The main thing I would say is to listen to your body. So your body is going to know what's right for you, your body's going to know what's wrong for you, your body's going to know when you've overdone it or you're close to overdoing it, and your body's going to know when maybe you haven't done enough movement. So I think listen to your body is really important.
Absolutely, and choosing when to do, well, I'd say to my clients a lot of the time, choose your battles. So if you've got a big family event coming up, a barbecue, or you want to go walking, you want to go out with the dog, something that's very important to you, go and do it, but the day before and the day afterwards, relax, rest in resting postures that are in the booklet that you'll be downloading, and just take it easy. So being active is important, but resting as well, and choosing how much activity your body is currently able to do is important. So moderating how much up and down stairs, how much housework, how much, I think the booklet specifically says you're not allowed to do the hoovering, so it's a good one to download. Yeah.
Show it to your partner.
Exactly. Okay, so that's kind of moderating your activity.
Yeah.
What about belts, Jill?
I've got mixed feelings about belts. I think they can really work for some people. I do think they should be not prescribed as such, but they should be given out or advised by a pelvic health physiotherapist who knows how to do all the tests necessary to find out whether that belt is going to be good for you, because there's quite a wide range of belts out there. There's really big ones that are going to lift your bump up and hold your pelvis together and squeeze your buttocks even, so it might just help all those muscles to work and to support your pelvis. And there's smaller ones that provide less support but maybe something that's more effective for you. So it is very individual, but I wouldn't say that I see massive improvement just from putting a belt on.
No, we know that a belt from the research shows that it's only effective as 70% of your muscles. So if your muscles are only working at 50 or 40% of their effectiveness, then putting on a belt will get you up to 70, which might mean that it's a bit more comfortable to walk, because of course you can't sit in a belt, you can't work in a belt if you're seated at a desk. But once you've got a bit more strength anyway, which is what we would be teaching you to have with all of our clients with these problems, then you don't need the belt. So most of the time I say to my patients, great, here's a belt, we need to be using it, it's going to help you, they feel better, but I want it back in 3 weeks, because by that point you've got that strength, you're not finding that you need to rely on it because your muscles are beyond the 70%, they might be 80 or 90% by then.
I think with your belts, sometimes what we find is it's a nice stopgap between when your muscles are weak before the exercises start to improve that muscle function. They can be really useful in providing that support so that you can get on with everyday activities and you can keep mobile. But they're not great if you're sat down all day.
No.
They're just going to dig into your groin and squash your tummy and make you out of breath, all sorts of problems. So usually
they're
when
not great really, especially when you get further on with pregnancy and the baby's head is maybe engaged. That belt's going to dig in at the back of baby's neck, so it's really maybe not that safe. So we use belts, we both use belts, we do prescribe them, but I think you need to see someone if you're going to think about using a belt, and just ask, is this going to work for me?
Definitely.
Okay. So when we think a bit more about what PGP is, and I think you've talked a little bit about the movement in the pelvis there, could you explain a little bit more about what that means and how people can get a bit better and feel better by not getting that pelvis to move so much?
So in pregnancy, your joints generally move a little bit more than they should do. So we're looking at the joints in your pelvis. You've got 3 major joints in your pelvis. You've got the symphysis pubis joint right at the front. That's where your pubic bones meet together at the top of your hips. And then you've got the 2 sacroiliac joints, or SIJs, at the back, right at the top of your buttocks. And that's where your pelvis and your tailbone joins onto your spine. So generally, those joints don't move a huge amount. I think we're talking a couple of degrees here and there. It's not a huge amount. But in pregnancy, they can move a little bit more, and they're susceptible to forces and stresses and strains from physical activity and the way we sit and the way we stand. So one piece of advice that I would give is to keep yourself symmetrical as far as you possibly can. So things like sitting down, you want to make sure that you've got equal weight through both of your buttocks.
So don't cross your legs.
Don't do that. That's very naughty. I'll slap you. Also, what a lot of people do is they come home from work and they bring themselves up into this position on the sofa because it's nice and comfortable. And you'll have that tendency of, I like sitting at this seat, if you're a Sheldon, if everyone has watched Big Bang.
Yeah.
But if you've got your own special seat and you sit in that one seat, you're going to be putting a lot of weight down through one seat bone and not very much weight through the other. You're going to lengthen one waist and shorten the other. And that causes asymmetry.
Real twist up in the pelvis, which will stretch those ligaments at the back if they're a little bit looser, and it might cause some soreness. But I mean, these tips are really, really great, and they tend to cut down the amount of pain people are in, but you need to make it a habit.
Yeah.
Because it's not going to be that you sit there once for 2 seconds and then you're in loads of pain. It's going to be repeated postures. The more that you do these things, the worse it gets. So sitting symmetrical, what else?
Standing symmetrically as well. So a lot of people sit for a job, they're not used to standing for long periods of time. You might be stood in a queue, or you might be going for a walk and you're waiting for something, whatever. You might be standing at the kitchen sink, it doesn't matter. But if you're putting more weight through one leg than the other, that's going to change the forces going through that pelvis. So you're going to stress and strain one side of your pelvis, and you're going to put a dragging force through the other. So that sort of movement of stress coming up through the weight-bearing leg and then pulling down through the non-weight-bearing leg can cause all sorts of problems within the muscle function around those joints. So you want to keep equal weight through both of your feet. Pilates is a really good way of learning how to do that, so you can become much more body aware.
Yeah, absolutely. In the booklet that you'll download, the link down there somewhere, down there, they've got some lovely resting positions as well. So a lot of people find it's really painful at night, and so there's some nice diagrams of how to lie on your side supported, and those are positions that you can come home from work and rest in, that you can, when you're finding that you're in a lot of pain, offload the pelvis and support it effectively. So that's a good booklet to read. Okay, so we talked about exercise. What do you say to your clients then who've got pelvic girdle pain but want to be fit, they want to keep active?
It's really important to keep active. Again, going back to our second point, choose your battles. So you've got to listen to your body and you've got to not try and do too much. So if you've had a very busy day, I wouldn't necessarily do a load of exercise. at the end of that day. But if you've been fairly sedentary that day, say you've been in the office all day or whatever, then doing a session of exercise could be really beneficial, either during the middle of the day, have a longer lunch, if that's possible for you, if you've got that luxury, or at the end of the day think, no, actually I'm going to take some time for myself and do some basic exercise. It doesn't have to be much. I wouldn't suggest any high impact exercise necessarily if you're getting pain, and any exercises that you do that feel to you that they're not quite right, like they're actually doing you harm, is probably worthwhile easing back on it and asking for some professional advice from a physiotherapist. Or
yeah, so there's plenty of physios around that run exercise classes, and if you get in touch with us, if you're in South Wales, we can point you in the right direction. Otherwise, seeking out specific antenatal Pilates classes or yoga classes or aquanatal classes, so things where you're not weight bearing heavily, you haven't got any high impact, so it's not, the force isn't going through your legs and through your body, you're not running, things like that, but you're supported. There are ways that you're going to develop abdominal, back, pelvis, hip strength, but without causing too much pain. Pilates is one of those wonderful types of exercises that you can do which will help you to gain all of this strength but without causing excess pain. So we would always say that's a good place to start. And actually, if you have a look in the drop down menu, you'll find that there is another video coming up about which Pilates exercises we do to help our women get stronger and not to have so much pain during pregnancy.
Yeah, there is also a booklet, the same link that you've got for that booklet about pelvic girdle pain, the same website has got a booklet on Pilates and women's health.
We can put that link on as well.
Yeah,
so there'll be another link down there.
So there'll be loads of links all over the place. Swimming, I think, is fantastic. I wouldn't do breaststroke legs if you've got pelvic girdle pain. Really, in pregnancy, I wouldn't do breaststroke legs. But just getting into the water and feeling that release of the weight of gravity on your joints makes a massive difference. Even getting into the water, 10-15 minutes floating can make a big difference. And there might be a flotation tank near you.
Yeah, they're fantastic. They're really good at taking off the pressure of the joints and making you feel much more relaxed, comfortable, helping you to reduce pain. Flotation tanks are fab.
Very relaxing as well.
Yeah.
Quite a nice spa.
But the important thing to think is that during pregnancy you shouldn't be sedentary. So we like to exercise. Our body is made to move, and it's made to move during pregnancy as well. So we know the benefits from exercising are huge. So the first 7 years of a baby's life, it's going to be a stronger, fitter, cardiovascularly, from a brain point of view, from lots of different, reduced diabetes, if the mother has exercised. And actually, babies at the age of 7 in Norwegian countries and other places, when the mother has exercised a lot, are actually a little bit cleverer, which is always a bonus.
That is a bonus.
Fitter, healthier, happier kids if the mum's exercised. But as we said, it doesn't have to be high impact, doesn't have to be strenuous. It can be Pilates based, swimming, those kind of exercises. So get out there, do it, but respect your body.
Yeah, that's the best advice.
Okay. So that's from us today. If you're interested in having a look at those exercises, head over to the other video. And we hope that you're feeling better soon.